Hello and welcome to the 2.0 conference in Las Vegas, Nevada. My name is Dee and I'm here with.
Dr. Pamela Cipriano.
And what corporation are you with?
So I am the founder and president of the Practice of Health and Wellness and the CEO of Hy-Vee Hydration Lounge and Med Spa in Thomaston, Connecticut.
Can you tell us more about it?
Sure. So I started my private practice in 2016. I was the first nurse practitioner in the state of Connecticut to open a solo practice, which was difficult. Connecticut, which is part of Connecticut, would not credential me because they never updated their bylaws.
Oh, okay.
And so I had to hire an attorney, and they had to pretty much force their hand to catch up with the law that was passed in 2014. So it was a lot of hard work.
Well, I'm glad you're here.
Thank you.
And tell us about the research study on preventing diabetes. What causes you to get involved and learn how to treat it?
So my dad was diagnosed with diabetes when I was 15 years old. He was in his 40s. And I remember thinking and telling him that if he changed his diet, he'd be able to reverse it. At 15, all 15-year-olds know everything. And he said he talked to his doctor, and the doctor said it was had something to do with his genes, that there was no way of reversing it. And so now, fast forward several decades, I'm now a nurse practitioner. I took a position with a primary care office from an elderly physician practice. One of them had retired, and I took over that side of the practice. And there were so many of my patients there that were either pre-diabetic or diabetic. And I ended up putting something together because talking about nutrition can be a very dry subject. So I put this diet together with all low in glycemic index and all foods with decreased inflammation. And everybody's A1C was improving. When I went back to school for my doctorate degree, I chose a program where you had to find a gap in your practice and figure out how to fix it. And so I had already done that. I spoke with my advisor, and we did a retrospective analysis. And so with the inclusion criteria, no one in the study could have ever had diabetes or been on any medication for things other than diabetes, as long as it was used for something like that. And what I found was that it was statistically significant. Everybody reduced their A1C just by changing their diet and increasing their activity level. And outside the study, I gave the same exact protocol to people who were very diabetic, and they reversed their diabetes.
Oh, wow.
So it's really all about diet and exercise. Yeah.
What advice would you give someone wanting to follow your footsteps?
If I can do it, anybody can do it. But you really need a lot of dedication, a lot of passion, and a lot of long nights. But it's definitely doable.
And how do you feel about getting the award?
I feel so honored to have been chosen for this award, and so humble to be in the same category as so many incredibly accomplished professionals.
Well, I'm glad that you're here and you're getting the award. You deserve it.
Thank you so much.
And what platform will you use for social media for them to reach out to you?
Oh, so we have Facebook. It's Dr. Pamela Cipriano, the Practice of Health and Wellness. We have Instagram, Health and Wellness. We see Practice Health Wellness. I think that's what that one is. And then you can find me on the website, thepracticeofhealthandwellness.com.
Thank you, guys.
Thank you.